This is Dr. Robert Caridi from Westlake Plastic Surgery, Austin Gynecomastia Center, Austin, Texas. Today I wanted to show you something about a seroma, which is basically a fluid collection that can happen in just about any surgery, but this is germane to my gynecomastia procedures. And I have a patient in the office today who was gracious enough to allow us to film his seroma removal. So it's a patient who had a small amount of gynecomastia that was removed. He noticed some puffiness on one side that wasn't on the other side. You can actually sometimes feel a little bit of a fluid wave as well, a little bit more bruising on that side. So he's already in today to see if we can get some fluid out. What I can show you is that this side here is nice and flat, his nipple's flat. This is the incision here. He's about a week out from surgery. Bruising is minimal. On this side here, his bruising is minimal as well, but you can see he's got a little bit more puffiness right over in this region here. And when I squeeze on this region here, I see some fullness over here. So that's not quite a true fluid wave, but I can actually easily feel this fluid in here. He probably has about 6 cc's or so of like serosangrinous or somewhat bloody fluid. So a seroma is just aspirated. Aspirated basically means that I use a syringe here with a small needle on the end here. I prep this area here, and then I take this and stick it under the area that I have done my surgery, and then I aspirate. And as you can see here, I am pulling out some fluid. And it's a strawberry colored classic seroma. The strawberry colored is really just the bloody part. The other part is just body fluids. And that's everything right there. This is nice and collapsed. I don't feel anything. This is flat, just like this side here. I've gotten it all, and I'm going to remove my little needle here. And I have about 10 cc's of fluid. Again, this is pretty watery. And then the issue really becomes, why do you get seromas? Every time you have an empty space in the body, the body wants to fill it in with fluid. Doesn't happen to everybody. Probably about 15–20% of patients get a small seroma. If you drink excess fluids after surgery, that can definitely predispose you to seroma formation. So don't be drinking tons of fluid and powering down Gatorade and liters of fluid. Drink in moderation, so just drink like normal person. Drink when you're thirsty. If your urine gets really yellow, then you probably have to drink some more. But there's no way to just absolutely avoid it. And if it does happen, it's pretty easily treated. An untreated seroma, however, if it doesn't resolve after a few weeks, can leave you a bursa, which is just a little sac in there, which could lead to some fullness, which can persist. So most cases, they go away uneventfully. In some cases that persist longer than several weeks, you're going to probably want to get in and have this thing aspirated. So I hope you found that helpful, and hopefully you'll consider the Austin Gynecomastia Center. Thank you.